Your child has been diagnosed with ADHD and has been prescribed Strattera. A lot of people ask just what ADHD feels like. We know what it looks like. Your child may not be finishing their homework, they may be acting out at school, and they may be running a million miles a minute, usually at the wrong times. I personally have ADHD, and I like to explain it like this. Having ADHD is like having a Ferrari motor. It can go 150 miles an hour and it's sharp. People with ADHD are usually pretty smart, as long as they're interested. But then we have the brakes of an old Model T. It will take us 45 miles to stop that fast brain of ours, and we frustrate a lot of people around us because we talk fast, jump from subject to subject, and can typically do 3 to 4 things at a time and have a hard time understanding why those around us can't. We can be taught to prioritize our time, complete tasks we don't want to complete, and even sit quietly through a class with the help of a counselor, or even positive reinforcement at home and at school. Adding a medication such as Strattera can help as well. The goal of treatment is to reduce the frustration felt by you and by your child by helping your child make it through a day they may think is boring without any phone calls home. There are some side effects that you should be aware of, starting with the black box warning. You will need to monitor your child for worsening of their condition, agitation, irritability, and suicidal thinking, especially within the first few months of taking Strattera, or any time a dosage is increased. This is especially important in children under the age of 18. Another side effect is your child may experience trouble sleeping, headaches, an upset stomach. They may not want to eat. They may have a dry mouth or trouble using the bathroom, and we call that constipation. They also may feel dizzy. There are also a few things you need to be aware of before you start taking Strattera. Strattera may take 3 to 4 weeks to improve your child's symptoms. It will need to build up in their symptom to a therapeutic level. This just means the drug is slowly getting in their system and it's slowly helping them improve. You don't want to stop taking Strattera without discussing it with your doctor. They may not see immediate improvement. If you are a male patient or have a son taking Strattera, be aware that no erection should last for more than 4 hours. You will need to seek immediate medical attention. You will also want to watch your skin. Although rare, Strattera can cause a severe liver injury. Yellowing of the skin and the whites of your eyes can be a sign of liver damage, and your doctor should be notified. When you take your medication, you should take it in a single dose in the morning. If you are prescribed 2 equally split doses, sometimes they do this so that your child can take it for their afternoon homework. You want to take 1 in the morning and 1 in the afternoon. You do not want to chew it. You don't want to split it. You do not want to break it, and you do not want to crush it. Take it whole. Strattera can be taken with food or without food. There are some people who should not take Strattera. Those taking an MAO inhibitor or who have taken an MAO inhibitor in the past 2 weeks should not take Strattera. You will need to get off of Strattera for at least 2 weeks before starting an MAO inhibitor as well. Pregnant women or breastfeeding women should not take Strattera, and patients younger than 6 years old should not take Strattera as well. Strattera can help treat ADHD. ADHD is not a disability. It can actually be a superpower. Strattera will help by improving your focus. It inhibits the reuptake of norepinephrine, that little chemical that is responsible for things like the flight or fight response. So in other words, the chemical that says, run away from the danger, or hey, you, let's fight. We've got this. By inhibiting this chemical, Strattera will increase your child's focus and allow them to complete the tasks they may feel are less interesting, like making a medication education video for school.